diseases are diseases about which we've heard a lot, but don't necessarily know a lot, and it seemed like an area where the science was progressing rapidly, so it held a great deal of interest. And for the 35 years I've been doing it, there's been a lot of change. So the answer is that everything has changed, but that's kind of what makes being in the field for 35 years sustainable. And while it can be difficult, because obviously not everybody does well, there's the hope and the promise that over time more and more diseases will become manageable, controllable, or even curable. Well, I think that personalized medicine may not be personal necessarily to you or to me, but I mean it's personalized meaning that you're going to have very precise diagnostics all the way down to the molecular level of everybody's tumor. And there's going to be a menu that you'll be able to choose from that will meet the needs of that particular tumor in terms of targeting the defects and treating them. So I think that more and more tumors will get treated that way. Now, some tumors may or may not go that way, but you know, if you look at testicular cancer, which 50 years ago was a terrible disease and a death sentence, and now, you know, 90% or more than 90% of patients with advanced disease are curable with chemotherapy, and it's the same chemotherapy that we were using when I was trained 35 years ago. But 90% of the patients are being cured, and you know, and if you're lucky, you can even win the Tour de France. In both hematology, which I do and enjoy, as well as oncology, we've seen a lot of interesting changes that are good for everybody. I mean, it's really better for patient care on every level. Obviously, different doctors have different approaches to their practice. I'm the son of a physician, and the first thing he told me when I entered medical school is always listen to the patient, because if you ask them the right questions, you'll get the right answers. And so I think that listening is really important. I try to take a lot of time with patients, which probably leads to my running late, but nonetheless, I think if you take the time and you listen, you not only develop a sense of trust with patients, you'll also get to the right answer a lot sooner and a lot more reliably.